Good morning. Welcome back to our school. In the last session, we have discussed about the control of blood sugar. Today, I am going to discuss about glucose tolerance test. What is glucose tolerance test? Glucose tolerance test is a laboratory method to check how the body breaks down or metabolizes blood sugar and how quickly it is cleared from the blood. And the main indication for doing this test is one is to diagnose diabetes mellitus. So you can say that glucose tolerance test can be used as a diagnostic test for diabetes. Also for detecting causes for various types of glycosuria, that is when the urine contains sugar, to want to know whether it is due to diabetes or due to some other reason. So these are the main uses of this test. So as mentioned, this is used to confirm diabetes mellitus. One of the diagnostic criteria is what is the 2-hour blood sugar after taking the glucose. This is used again for diagnosis of gestational diabetes mellitus. As mentioned, different types of glycosuria, that is alimentary glycosuria and renal glycosuria, that is urine shows sugar. To want to know whether it is due to diabetes or due to some other reason, we'll come to that. So what are the preparations for this? The patient should be on unrestricted carbohydrate. By this we mean approximately 150 to 200 grams of carbohydrate containing food should be taken by the patient 3 days at least before the test. In the evening, patient should be taking carbohydrate meal of 30 to 50 grams. And patient should be fasting for 8 to 12 hours. That is, the OGTT is usually, OGTT means oral glucose tolerance test. This is usually done in the morning. Patient is instructed to fast, that is 8 to 12 hours of fasting is required. Hope this point is clear to you. Now we come to the procedure. How will you do the test? So I have mentioned the patient should be taking 150 to 200 grams of glucose containing, not glucose, carbohydrate containing diet for the last 3 days. Patient should have taken a meal which contains carbohydrate of around 30 to 50 grams the previous night. And they will be fasting for at least 8 to 12 hours. These are the prerequisites for the procedure. So how will you do it? In the morning, that is a 0 time, that is a baseline. So 0 time is the baseline. We start the test. Patient is given 75 grams of glucose in 250 to 300 ml of solution, and allowed to drink within 5 minutes. So that is at the 0 hour you give the 75 grams of glucose containing fluid. Blood is taken every 30 minutes. Every 30 minutes you take the blood for 2 hours. Along with that you take the urine also, and you check the blood sugar and urine sugar every half hour. This is the ideal way of doing the oral glucose tolerance test, but routinely for diagnosis of diabetes nowadays we use only the first sample and the 2-hour sample. That is, the fasting sugar and postprandial sugar is only required for doing usually in clinical practice. Hope this point is clear to you. So that is for simple diabetes screening and diagnosis, the most important sample is the 2-hour sample. That is 2-hour postprandial sugar is taken for diagnosis of diabetes, and also the fasting plasma glucose. So this should be the important point to be kept in mind. Hope you understood that is routine practice, 2-hour and fasting and 2-hour samples are taken. Okay. Now there is a modification of this test called the glucose challenge test. This is not routinely done. Here what is given is 50 grams of glucose is given irrespective of the time of taking your food. Whether you have taken food or not, you give 50 grams of glucose and check the blood sugar 1 hour later. and see that the sugar is below 180. If it is more than 180, you have to go for further testing again. So that is why this test is not routinely done. So we have mentioned about the procedure of the glucose tolerance test, oral glucose tolerance test, where 75 grams of glucose is given. And you take the samples every 30 minutes for 2 hours. And you check the urine for sugar and also blood for the sugar. Okay. Now we go into the results. As we know, the blood sugar is maintained at a narrow range. That is, the normal sugar range is very narrow. Normal is usually 70 to 100 milligram. This is the normal range. So the fasting sugar, if it is 126 or above, you can consider that the patient in the presence of symptoms, this is diagnostic of diabetes. That is, a patient has got a blood sugar of 126 milligram or above, the patient is having diabetes. The value between this, that is between 100 and 126, is called impaired fasting glucose. It is a pre-diabetic stage. Pre-diabetic. So then the postprandial sugar after 75 grams of glucose should be below 140 milligrams. So for a normal person, the fasting sugar should be between the range of 70 to 100 and postprandial sugar should be below 140. That is the normal range. If the sugar is more than 140 but less than 200, 200 is the cutoff value. If it is more 200 or more, patient is having diabetes mellitus. Between 200 and 140, this is called, again pre-diabetes, it is called impaired glucose tolerance. So these are the values that you should remember. That is, fasting sugar is 70 to 100. Postprandial sugar should be less than 140. Above 140 but below 200, you call it impaired glucose tolerance. More than 200, you can say the patient is having diabetes mellitus. So these are the important points to be kept in mind. Hope this is clear to you. That is, fasting sugar more than 126, postprandial sugar after 75 grams of glucose, unheteros glucose more than 200, patient is having diabetes. In the absence of symptoms, this test has to be repeated once more. If the patient has got typical symptoms of polyuria, polydipsia, polyphagia, and unexplained weight loss, there is no need to repeat the test. Or somebody has got a random blood sugar more than 200, then again the patient can be called as diabetic. Another method of testing diabetes, diagnosing diabetes, is the hemoglobin A1C, more than 6.5. You can take it as diabetes. We will come to that at a later session. Hope you understood the normal values. I mean, the 1 hour value, as mentioned earlier, it should be less than 180. Because 180 is the renal threshold, you know. If more than 180 blood sugar in a normal person, urine will contain sugar. So the normal 1 hour. So this usually 1 to 1.5 hour, the maximum peak of blood sugar occurs. The 2 hour sugar should be 140 milligram. I already mentioned, remember the value 140 in a normal person. Between 140 to 200, you call it as impaired glucose tolerance. I explained this earlier. Blood sugar more than 200 milligrams, 2 hour confirms diagnosis. So this is a confirmatory test or a diagnostic test you can be used. Confirmed diabetes mellitus. Okay. The result I will again explain once more. Fasting plasma glucose measured before the OGTT should be below 100 milligrams. Between 100 and 125, it is pre-diabetes, impaired fasting glucose. 126, diagnostic of diabetes. 1 hour sugar is should be below 180. 2 hours should be normally less than 140. 140 to 200 is pre-diabetes, impaired glucose tolerance. and plasma glucose above 200 milligram after 2 hours of 75 grams of glucose, the patient is having diabetes mellitus. Hope this point is clear to you. So we have explained the results of oral glucose tolerance test. What is a normal value, what is pre-diabetes, what is diabetes. Now we can chart this as a graph, and this is called the glucose tolerance curve. The curve is plotted with the blood sugar on the vertical axis and the time on the x-axis. So the y-axis is the glucose in milligrams and x-axis is the time. And you plot these values and you get a curve. That curve is called the glucose tolerance curve. Hope it is clear to you. That is, the values are plotted as a graph. In the y-axis, glucose in milligrams, and in the x-axis, the time is plotted. So here we can see a patient. The fasting value is 90, 30 minutes is 100, 60 minutes is 150, and 90 minutes 120. We'll try to plot it and see what will happen. So this is the curve which you get. So you can guess, we have plotted these values. Okay. So what does it value? The fasting sugar is between less than, it is around between below 100. So the fasting plasma glucose is normal. Postprandial 1 hour is less than 180. Here it is only 150, and 2 hour sugar is 70. So this is a normal glucose tolerance curve. So this chart may be given in an examination, you will be asked to explain. So look at the fasting sugar, look at the 1 hour value, look at the 2 hour value. Hope this is clear. So the normal glucose tolerance curve is, I have explained. At 0 hour is 90 milligrams within normal limits. Peak value at 1 hour is again within normal limits. The blood sugar has come down to normal value. So this is the example of a normal glucose tolerance curve. Now we will take another example. So here we can say the fasting is 200, 30 minutes is 225, 60 minutes is 300, 350, and 2 hours is 210. Definitely this patient is having diabetes. Fasting is high, postprandial is high. So this patient has got a diabetes mellitus. So if you plot it, this will be like this. The fasting sugar is high, the 2 hour, the 1 hour, the peak value is high, and postprandial is high. So this is a diabetic curve. Again, seeing this graph, you should be able to diagnose what is the type of curve. Now we look into a particular situation. A patient has got a fasting sugar of 70. Postprandial sugar is 120 after 75 grams of glucose. But when you have tested the oral glucose tolerance test, you found that the urine showed sugar in 1 hour value and 1.30 or 1.5 hour, the urine sugar is positive. So if you draw the chart, it will be like this. Fasting sugar is normal, that is below 100. But it has found that 1.5 hour sugar is well above 180. That is, it is 180. And you can see that it has come down to normal. So 2 hour value sugar is normal, fasting is normal, but 1 hour value, you can see that it is high. It is well above the renal threshold. That is why urine contains sugar. This is called alimentary glycosuria. What do you mean by this alimentary glycosuria? That is, there is increased absorption of glucose from the intestines in certain situations like thyrotoxicosis in pregnancy. This can happen. That is, what is alimentary glycosuria? Here the fasting sugar is normal, 2 hour postprandial sugar is normal, but in between 1 or 1.5 hour urine shows sugar. In many pregnant people, especially in the last trimester, you can get glycosuria with a normal sugar. Keep this point in view. Then one more situation is renal glycosuria. In renal glycosuria, the patient will have The fasting sugar is normal, 2-hour sugar is normal, but the urine shows sugar in many samples. So if you plot the graph, it will be like this. This is the x-axis time, 2-hour. This is 0-hour. And you see that the graph is the fasting sugar less than 100. The 1-hour value is less than 180. So the graph is like this. But the urine shows sugar in samples. What is the reason for this? We know that the renal threshold for appearance of sugar in urine is 180. Here, even before reaching that threshold, urine has sugar or glucose. This is because the renal threshold has come down. This is called renal glycosuria. This can occur congenitally in certain renal tubular disorders like Fanconi syndrome. You will study about it later. Following renal tubular disorders, acute tubular necrosis you can get. So in many conditions this can occur. This is called renal glycosuria. Then there is something can go to a flat curve, that is not much absorption occurring. The graph will not be rising much. This is called a flat curve that can also occur. So we have discussed about various abnormalities in the glucose tolerance curve, how the test is done, what are the prerequisites. In pediatric age group, the amount of sugar is given different. It is given as a by weight base. In GDM, usually the cutoff is the fasting sugar is taken less than 95 is normal, and your value should be less than 140. And if it is more than 140, we call it as GDM. This is a simplified criteria by the DIPSI. That is, the impaired glucose tolerance of a normal person is considered as gestational diabetes. Hope you understood key points of this oral glucose tolerance test. Stay tuned. Thank you.